Hey guys, tonight we're not just talking about history, we're talking about the part of history that makes you grateful for modern medicine. We're traveling back to the Middle Ages, a time when doctors believed your body was a fragile container of colored fluids, and a stomachache could be cured with a potion made from a rooster's brains. You think a trip to the doctor is bad now? Try having your appendix removed by a barber with a rusty knife. You'll probably be glad you're just listening to this in a warm, cozy bed. So, before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here. Let me know where you're listening from and what time it is for you. Now, dim the lights, maybe turn on a fan for that soft background hum, and let's ease into tonight's journey together. You have a headache. It's not a bad one, just a dull, persistent throb behind your eyes. But in your world, the world of the Middle Ages, even a minor ache is a cause for concern. You see, your body is not a complex machine of cells and organs. It is, according to the great physicians of the past, a delicate balance of four essential fluids, or humors blood: yellow bile, black bile, and phlegm. A healthy body is one where these four humors are in perfect, harmonious balance. Your headache. It's a sign that something is terribly, horribly wrong. You have too much of one of them. Or maybe not enough. It's a bit of a guess. Really. You go to see the local doctor, a man who looks less like a healer and more like a scholar. He wears a long, flowing robe and carries a thick, leather-bound book. He doesn't ask you about your symptoms in detail. He doesn't feel your forehead or check your throat. Instead, he asks you about your diet, your sleep, your emotional state. He believes that your mood and your health are inextricably linked to the balance of your humors. Your headache, he decides, is caused by an excess of blood, a hot and passionate humor. You have a plethora of it, an abundance that needs to be released, and he has just the cure. He tells you that you need to be bled. You need to have some of that excess blood drained from your body to restore the balance. He pulls out a sharp, gleaming blade and a bowl, and he gestures for you to sit. You feel a prickle of fear. You've heard stories of people being bled and getting worse, of infections and fevers setting in. But the doctor is a respected man, a man of learning. You have to trust him. He makes a small incision in your arm, and you watch, a bit dizzy, as your bright red blood flows into the bowl. He watches it, too, studying the color and the consistency, as if it is a map to your inner self. You feel a bit faint, but he assures you that it is working, that your humors are returning to a state of perfect harmony. One of the most disturbing, and frankly insane, aspects of this system is the use of astrology. Your doctor doesn't just rely on his own judgment, he consults the stars. He believes that the planets and constellations have a direct influence on the humors in your body, and certain times of the day and month are better for treatments than others. He looks at a chart of the zodiac and decides that the best time for your bleeding is when the moon is in a specific position in the sky. It's a cosmic diagnosis, a strange mix of medicine and magic that is both fascinating and terrifying. Let's lighten the mood with a bit of a grim joke, shall we? You're in the doctor's office and a man comes in with a terrible cough. The doctor, without missing a beat, pulls out a live pigeon and tells the man to put its feet on his chest. The man looks at him, confused, and asks, "What will that do?" The doctor shrugs and says, "Well, the pigeon will probably die, but at least we'll know the sickness is real." It's a dark kind of humor, a desperate laugh in the face of a terrifying reality. The academic debate about how widely the four humors theory was believed is an interesting one. While it was the dominant medical theory for centuries, some historians argue that local folk medicine and herbal remedies were more common, especially in rural areas. They argue that the average peasant would have been more likely to go to a wise woman with her strange potions than to a learned doctor with his bleeding bowl. But you, living in a small town, have access to both. And you know that both come with their own risks. After the bleeding, you feel a bit weaker, a bit dizzy. Your headache is still there, a dull, insistent throb. But you are told that you are now on the path to recovery. Your humors are balanced, and your body can now heal itself. You leave the doctor's office with a list of instructions: eat more warm foods, avoid cold drinks, and rest for a few days. You go home, a bit more scared than you were when you left. You have a new respect for the fragility of your own body, a new awareness of the unseen forces that are constantly at play within you. And as you lie down in your bed, you feel a kind of strange, resigned peace. You are not just a person, you are a complex, mysterious collection of humors. And you are at the mercy of a theory that is both elegant and terrifying. Your headache didn't go away. In fact, it's gotten worse. A pounding rhythm that makes you wince with every step. The bleeding didn't work. Your humors are still out of balance. So, you go to the other kind of healer in town, the barber surgeon. You walk into his small shop, and the smell of blood, hair, and something a bit metallic fills the air. This is a man who can cut your hair, shave your beard, and, if you're unlucky, cut off your leg. He is a man of many talents, and you are about to experience the most terrifying of them. He's a big, burly man with a leather apron stained with 1,000 different fluids. He has a set of tools that would make a modern person faint a rusty saw, a pair of forceps that look more like tongs, and a collection of blades of all shapes and sizes. He is not a learned man like the doctor. He is a man of action. He believes that the body is a machine, and if a part of it is broken, you just cut it out. It's a brutal, simple philosophy, and you are a bit scared of him. You tell him about your headache, and he nods, a grim look on his face. He doesn't believe in humors. He believes in things you can see and touch. He thinks your headache is caused by something more practical, like a bad tooth. He opens your mouth and pokes around with a terrifyingly large hook, making you gag. He finds a tooth that is a bit loose and says, "This is the source of your pain. We will remove it." You feel a wave of pure terror. You remember the last tooth extraction you saw. A screaming, bloody mess that left the man with a gaping hole in his mouth. He tells you to bite down on a piece of wood, a simple stick that is meant to keep you from biting off his fingers. He takes out a pair of large, rusty pincers, and he puts them around your tooth. He tells you to hold still, and you try, but your body is shaking with fear. He gives a mighty pull, and you feel a sickening crunch, a searing pain that makes your eyes water. You hear a loud crack, and you feel the tooth come loose from your gum, a sudden, horrifying release. He pulls it out, a bloody, jagged mess of bone and nerves. The pain is intense, a throbbing, searing fire that makes you want to scream. But you don't. You can't. You have to be strong. One of the more horrifying truths about medieval surgery is the lack of sanitation. There is no such thing as sterilization. The barber surgeon uses the same tools on everyone, wiping them off with a dirty rag between patients. The risk of infection is astronomical. You see the blood on his apron, the grime under his fingernails, and you feel a new kind of dread. You hope that you don't get a fever, that the wound in your mouth doesn't fester and rot. You just have to trust in fate, and in the sheer resilience of your own body. Let's have a quick, grim laugh, shall we? You're sitting in the barber's chair, and a man comes in with a terrible cut on his arm. The barber surgeon looks at it, shrugs, and says, "That's a nasty one. I'll just sew it up with a bit of thread and a needle." The man looks at him, confused, and asks, "What kind of thread?" The barber surgeon grins and says, "The same kind I use for my stockings." You don't know if he's joking, and you don't want to find out. The academic debate about the skill of barber surgeons is still ongoing. Were they simply butchers with sharp tools? Or did they have a surprising amount of practical knowledge? Some historians argue that they were skilled at setting bones, treating wounds, and even performing basic amputations. They were not learned men, but they were men of action, and they often saved lives through sheer grit and practicality. You look at the bloody tooth in the barber's hand, and you think to yourself, He may not be a doctor, but he sure knows how to pull a tooth. You leave the shop with a gaping, bloody hole in your mouth. Your headache is still there, but it is now overshadowed by a searing, throbbing pain in your jaw. You have a new respect for your teeth and a new fear of the barber surgeon. You are a bit poorer, a bit weaker, and a lot more scared. You think to yourself, I'm glad that's over. But you know, deep down, that it's not. The world is a dangerous place, and your body is a fragile, unpredictable machine. And you are at the mercy of men with sharp tools and a willingness to use them. Your headache, it turns out, was not caused by a bad tooth. The throbbing is still there, a constant reminder that something is deeply wrong. You go to a new doctor, a man who looks at you with a strange kind of intensity. He asks you to provide a sample of your urine. This is the urinalysis of doom, a diagnostic tool that is both simple and, to a modern mind, utterly revolting. You give him a small vial of your urine, and he holds it up to the light, studying it as if it were a fine wine. He is a pissy prophet, a man who believes he can see the future of your health in a bottle of your own bodily fluid. He looks at the color, the clarity, the sediment. He notes its smell, a strange and potent odor that is unique to you. He swirls it, shakes it, and then, in a move that makes you want to gag, he takes a small sip. He tastes it, a concentrated bitter sip of your own sickness. He says, a bit sweet, a bit thick. He is a connoisseur of urine, a man who has tasted 1,000 different ailments in 1,000 different patients. He is looking for a specific taste, a specific quality that will tell him what is wrong with you. He decides, after his taste test, that your humors are still out of balance. But it's not a plethora of blood. It's a problem with your phlegm, a cold and wet humor. Your phlegm is too thick, too sluggish, and it is clogging up your brain, causing the headache. He has a new cure for you, a cure that is just as disturbing as the last one. He tells you that you need to be purged. You need to get all that excess phlegm out of your body, and he has just the potion to do it. He gives you a small vial of a dark, murky liquid. It smells like a mixture of herbs and something rotten. He tells you that it is a powerful emetic, a medicine that will make you vomit and get all that bad phlegm out of your system. You look at it with a sense of dread. You remember the last time you took an emetic, a violent, sickening experience that left you weak and exhausted for days. But you have to trust him. He is a doctor. He has tasted your urine. He knows what he is doing. One of the more bizarre and little-known facts about urinalysis in the Middle Ages is the use of a color chart. Doctors had a specific chart with a dozen different colors, from a pale, watery yellow to a dark, cloudy brown. Each color was linked to a specific ailment, a specific imbalance of humors. Your urine is a deep, murky yellow, and he consults the chart, his finger tracing the lines, a sense of deep concentration on his face. It's a surprisingly scientific approach for a practice that is so incredibly unhygienic. Let's take a quick, disgusting break for a dark joke. A man goes to the pissy prophet with a strange, dark-colored urine sample. The prophet looks at it, sniffs it, and tastes it, a grimace on his face. He looks at the man and says, "Sir, your urine tastes of burnt toast." The man, confused, asks, "What does that mean?" The prophet shrugs and says, "It means your kitchen is on fire." It's a reminder that even in the face of death and disease, people still find a way to laugh. The academic debate about the effectiveness of urinalysis is a fascinating one. While the methods were obviously flawed, some historians argue that the doctors were able to diagnose some ailments, like diabetes, from the sweetness of the urine. They also argue that the color of the urine can, in fact, tell you a lot about your hydration and diet. So, while the pissy prophets were a bit off in their methods, they were on to something. But you, in your sickened state, don't care about academic debates. You just want to feel better. You go home and take the emetic. It is a violent, sickening experience. You vomit for hours, your body convulsing with every heave. You feel weak, your muscles aching, your head pounding. But when it's over, you feel a kind of strange lightness. You have purged yourself of the sickness. You have released the phlegm. You have rebalanced your humors. Your headache is still there, but it is a bit fainter now, a bit less insistent. You have a new respect for your own stomach, and a new fear of anything that will make you vomit. You are a bit poorer, a bit weaker, and a lot more scared. You think to yourself, I'm glad that's over. But you know, deep down, that it's not. The world is a dangerous place, and your body is a fragile, unpredictable machine. And you are at the mercy of a man who tastes your pee. You're still not well. Your humors, despite the bleeding and the purging, are still out of balance. You feel a heavy, sluggish feeling in your head, a kind of mental fog that makes it hard to think. The doctor, a different one this time, a man with a scholarly look and a solemn face, has a new theory. Your problem, he believes, is not with your phlegm, but with your blood. You have too much of it, and it is stagnant, a thick, corrupted fluid that is poisoning your body. The only way to fix it, he says, is to drain the corrupted blood and replace it with fresh, healthy blood. This is the horrifying world of bloodletting, and you are about to experience it again, but with a new and even more disturbing twist. He doesn't use a knife this time. He uses a leech. He pulls out a small, slimy creature from a jar of water, a black, writhing thing that makes you shudder. He places it on your forehead, right between your eyes, and you feel a strange, squirming sensation. The leech is cold and slimy, and you can feel its suckers clinging to your skin. 1,000 tiny mouths working their way into your flesh. It is a disgusting, horrifying feeling, and you try not to think about it. The leech gorges itself on your blood, its body swelling and expanding, its color changing from a sickly black to a bloated, reddish purple. You can feel it pulling, a steady, insistent tug that makes you feel a bit faint. The doctor watches it with a kind of clinical fascination, a grim sense of satisfaction on his face. He believes that the leech is a miracle worker, a living tool that can remove the corrupted blood and restore the balance of your humors. You just feel a deep, primal revulsion. The procedure is a long, slow, and disgusting process. The leech sucks your blood for a long time, its body growing fatter and fatter, until it finally falls off, a bloated, disgusting lump of flesh and blood. You look at it, a wave of nausea washing over you. The doctor looks at the tiny wound on your forehead, a small red mark that is still bleeding. He tells you that you are now on the path to recovery, that the corrupted blood has been removed, and that your humors will soon be in perfect harmony. One of the more bizarre and little-known details about bloodletting is that it was also used as a preventative measure. People would go to the doctor and be bled on a regular basis, even if they weren't sick, to maintain the balance of their humors. You would go to the barber surgeon and say, "I'm feeling a bit off. Could you give me a good bleeding?" It was a kind of health spa, a way to maintain your wellness. You look at the leech on the table, and you shudder at the thought of voluntarily subjecting yourself to this horrifying procedure. Let's have a quick, disgusting laugh, shall we? You're in the barber surgeon's shop, and a man comes in with a leech on his nose. He looks at the barber surgeon, confused, and says, "I don't know what happened. I just woke up with this thing on my face." The barber surgeon looks at him, shrugs, and says, "Well, it looks like you've been a bad boy, and the leeches have come to punish you." The man faints. It's a reminder that a little bit of superstition and a lot of disgusting humor can make a terrible situation a bit more bearable. The academic debate about the effectiveness of bloodletting is a fascinating one. While modern medicine has proven that it is a completely ineffective and often dangerous practice, Some historians argue that it may have had a psychological effect on patients. The patient believed that the procedure was working, and the power of their own mind helped them to feel better. It was a placebo effect on a massive, horrifying scale. You feel a bit better now, a bit lighter, and you wonder if it's the leech or just the power of your own belief. You leave the doctor's office with a small wound on your forehead, a constant, nagging reminder of the leech. Your headache is a bit fainter now, a bit less insistent. You are a bit poorer, a bit weaker, and a lot more scared. You think to yourself, I'm glad that's over. But you know, deep down, that it's not. The world is a dangerous place, and your body is a fragile, unpredictable machine. And you are at the mercy of men who believe that a slimy creature from a jar can cure your ailments. The leech on your forehead has left a small, red mark, and your headache, while a bit better, is still there. But now, there is a new terror in town, a quiet, creeping dread that makes the hair on the back of your neck stand up. People are getting sick, a strange, new sickness that makes them break out in terrible sores and fever. They call it the plague, and it is sweeping through the towns and villages with a horrifying speed. The doctors, the learned men, and the barber surgeons are powerless. But now, a new kind of doctor has arrived, a terrifying figure in a strange, unsettling costume. The plague doctor. You see him walking down the street, and a shiver runs down your spine. He wears a long, black coat, a wide-brimmed hat, and a pair of gloves. But the most terrifying part of his costume is the mask. It is a beak-like mask, a long, curved beak that is filled with a mixture of herbs, flowers, and spices. He believes that the plague is spread by miasma, a kind of bad air, and that the herbs in his mask will protect him from the sickness. He also carries a long, wooden stick, a kind of cane that he uses to poke and prod at the sick without having to touch them. He is a horrifying figure, a bird-like creature from a nightmare. He walks through the town, his beak-like mask a symbol of death and despair. You see him go into a house, and you know that someone in that house is sick. You see him come out a few hours later, and you know that someone in that house is now dead. He is a grim reaper, a messenger of death, and his presence fills you with a sense of dread. One of the more disturbing and little-known facts about the plague doctor's mask is what it was filled with. It wasn't just herbs and spices. It was often filled with a mixture of dried flowers, camphor, myrrh, and even chopped-up dried toads. The doctors believed that the smell of these things would counteract the bad air, and they would walk around with this disgusting, potent mixture in their beaks. You think about the smell, a sickening mixture of herbs and dead toad, and you feel a wave of nausea. It is a horrifying kind of self-preservation, a desperate attempt to stay alive in a world of death. Let's add a bit of a grim laugh to this terrifying reality. You see a man walking down the street with a terrible fever, and he sees the plague doctor walking towards him. The man, in a moment of desperation, runs into the nearest tavern and hides under a table. The plague doctor walks into the tavern, looks around, and says, "I smell a sick man. He smells like he's been drinking too much ale." The bartender, confused, asks, "How do you know?" The plague doctor shrugs and says, "My nose is filled with dried toad, and I can smell anything." It's a dark, disgusting joke that makes you want to laugh and vomit at the same time. The academic debate about the effectiveness of the plague doctor's costume is still ongoing. While the mask obviously did nothing to stop the spread of the disease, some historians argue that the long coat and gloves may have provided some protection from fleas, which were a primary carrier of the plague. So, while the doctor's methods were flawed, their costume may have, in a strange, accidental way, saved some lives. But you, in your terrified state, don't care about academic debates. You just want to stay away from that horrifying mask. The plague is a terrifying, unstoppable force. You see your neighbors, your friends, and your family members fall sick. You see the sores, the fevers, the terrible delirium. You see the bodies piled up in the streets, a horrifying testament to the power of the sickness. The doctors are powerless. The prayers are unanswered. And the world is a terrifying place. You feel a sense of utter helplessness, a sense of resignation. You are at the mercy of a disease that is a mystery. And you are at the mercy of doctors who are little more than grim reapers. And as you watch the plague doctor walk away, his beak-like mask a terrifying silhouette against the sky, you feel a deep, cold dread. You're just waiting for your turn, waiting. The plague seems to have spared you, a small, terrifying mercy. But your headache, that persistent, nagging throb, is still there. You have bled, you have purged, you have even had leeches on your face. Nothing has worked. You feel a deep sense of despair. You are a modern man in a medieval world, a man who knows that his body is a machine, and you are constantly frustrated by the strange, illogical treatments you are subjected to. But now, you have a new option, one that is not based on humors or medicine, but on faith. Your sickness, you are told, is not just a physical ailment, it is a punishment from God. And the cure is a strange mix of prayer and potent potions. You go to see the local priest, a man with a stern face and a kind heart. He looks at you with a sense of pity. He believes that your sickness is a result of your sins, a punishment from a wrathful God who is testing your faith. He tells you that you need to repent, to pray, to atone for your sins. You feel a sense of frustration. You have been a good man, a hard-working man. What sins have you committed that could cause such a persistent headache? But you have to trust him. He is a man of God. He gives you a strange mixture of herbs and holy water, a dark, murky liquid that smells like a mixture of incense and something a bit unpleasant. He tells you to drink it every day, to pray to God, and to ask for forgiveness. You drink it, a bitter, unpleasant sip that makes you gag. It's a kind of penance, a physical punishment for a spiritual ailment. He tells you to wear a small amulet around your neck, a piece of wood with a cross carved into it. He says that it will protect you from evil spirits, which can also cause sickness. You look at it, a small, insignificant piece of wood, and you wonder if it will do anything. One of the more bizarre and little-known facts about medieval religious medicine is the use of relics. If you were sick, you could go to a monastery and touch a bone or a piece of cloth from a saint. People believed that the saint's holiness could cure your ailment. You have heard stories of people being cured of terrible diseases by touching a saint's bone, and you feel a strange sense of hope. It is a world where magic and medicine are one and the same. A world where a saint's finger can cure a fever. Let's have a quick, holy laugh, shall we? You're in the church, and a man with a terrible cough comes in and asks the priest for a cure. The priest gives him a piece of bread and tells him to eat it. The man eats it, and his cough gets worse. He goes back to the priest, confused, and asks, "What happened?" The priest shrugs and says, "Well, the bread was blessed, so at least you're not going to hell." It's a kind of spiritual humor, a desperate laugh in the face of a terrifying reality. The academic debate about the role of the church in medieval medicine is a fascinating one. While the church's focus on spiritual causes for sickness may seem strange to a modern mind, some historians argue that the monasteries were actually a source of medical knowledge. The monks kept libraries, translated ancient texts, and grew medicinal herbs. So, while they may have been a bit off in their spiritual diagnoses, they were also a source of real, practical knowledge. You look at the priest, a man who is both a spiritual guide and a healer, and you feel a sense of confusion. Is he a doctor or a priest? The answer is both, and you don't know which one to trust. You leave the church with a strange mixture of hope and fear. You drink the potion, you wear the amulet, and you pray to a God who feels both distant and terrifyingly close. Your headache is still there, a constant, nagging reminder that you are a sinner. You think to yourself, I'm glad that's over. But you know, deep down, that it's not. The world is a dangerous place, and your body is a fragile, unpredictable machine. And you are at the mercy of men who believe that your sickness is a punishment from God. The priest's holy water and prayers did nothing. Your headache persists, a stubborn, throbbing beast that refuses to be tamed. You have been bled, purged. Leeches have feasted on your blood, and you have prayed until your knees ached. You are at your wits' end. But there is one last resort, one last hope in this brutal, illogical world. You go to see the sorcerer, the local wise woman, a woman who lives on the outskirts of town and is both feared and respected. She is a woman who deals in a kind of medicine that is part herbal remedy, part ancient spell. You walk to her small cottage, a humble home surrounded by a wild, unkempt garden of strange plants and herbs. The air around her home is thick with the scent of smoke, herbs, and something a bit earthy. She is an old woman, her face a roadmap of wrinkles and lines, her eyes a deep, piercing blue that seems to see right through you. She doesn't ask you about your humors or your sins. She just looks at you, a knowing look on her face, and says, "The spirits are restless in your head." You feel a sense of relief. Finally, someone who understands. She tells you to sit, and she begins to prepare a poultice, a thick, green paste made from a mixture of herbs and something that looks suspiciously like dirt. She grinds them together in a stone bowl, her movements slow and deliberate, a kind of hypnotic rhythm. She hums a strange, low tune, a kind of chant that fills the small cottage with a sense of otherworldly power. She is a healer, a spiritualist, a witch, and you don't know which one she is. And you don't care. You just want the pain to stop. She places the poultice on your forehead, a cool, soothing sensation that brings a sense of immediate relief. The smell of the herbs is strong, a potent mixture of mint, lavender, and something you can't quite identify. She wraps a cloth around your head, holding the poultice in place, and tells you to lie down and rest. She gives you a small vial of a clear liquid, a kind of tea, and tells you to drink it. It tastes like a mixture of honey and something a bit bitter, and you drink it all, a sense of desperate hope in your heart. One of the more fascinating and little-known facts about medieval folk medicine is the use of sympathetic magic. The wise woman might use a plant that looks like a body part to cure that body part. For example, a plant with a leaf shaped like a liver would be used to cure liver ailments. It's a kind of poetic, illogical magic that is both beautiful and absurd. You look at the poultice on your head, and you wonder if it's the herbs or the magic that is making you feel better. Let's have a quick, magical laugh, shall we? A man goes to the wise woman with a terrible stomach ache. She gives him a potion and tells him to drink it and then run around his house 3 times. The man does it and comes back a few hours later, still in pain. The wise woman looks at him, confused, and says, "Did you run clockwise or counterclockwise?" The man looks at her, confused, and says, "Does it matter?" The wise woman shrugs and says, "Well, the potion only works if you run counterclockwise, so you're out of luck." It's a reminder that even in the most mystical of settings, there is a place for a bit of absurdity. The academic debate about the effectiveness of folk medicine is a fascinating one. While the sympathetic magic was obviously nonsense, many of the herbs used by wise women, like willow bark for headaches, a source of aspirin, had real medicinal properties. So, while their methods were flawed, their results were often effective. You don't know about aspirin, but you do know that the poultice is working. The throbbing in your head is fading. A gentle, almost imperceptible release. You feel a sense of peace, a sense of calm that you haven't felt in weeks. You leave the cottage with a bandage on your head and a small vial of tea in your hand. Your headache is a dull ache now, a memory of the pain that was so overwhelming. You are a bit poorer, a bit weaker, and a lot more hopeful. You think to yourself, "I'm glad that's over." But you know, deep down that it's not. The world is a dangerous place, and your body is a fragile, unpredictable machine. But you have a new ally, a wise woman with a garden full of strange plants and a mind full of ancient spells. And you feel a sense of comfort in that. The headache is gone. Completely. The poultice and the tea worked. A strange, beautiful magic. You feel a sense of profound relief. A kind of lightness in your head that you haven't felt in months. But your world is still a terrifying place. And your body is still a fragile, unpredictable machine. You see a man walking down the street. A friend of yours. A man who has been complaining of a terrible cough and a persistent fever. He looks pale. His eyes are wide with a kind of terrified desperation. He has been told that his sickness is not from humors or from sin, but from something far more terrifying, evil spirits, trapped inside his head. And the only cure is a brutal, horrifying procedure trepanning. You follow him to the local surgeon, a man who is not a learned doctor or a spiritualist, but a craftsman of a different kind. He is a man who deals in bone, in flesh, in blood. He has a set of tools that look like they belong in a blacksmith shop, a drill, a saw, a chisel, and a hammer. He has a grim, determined look on his face. He believes that the body is a cage, and if a spirit is trapped inside, you have to break the cage to let it out. It's a brutal, simple philosophy, and you are about to witness it in action. Your friend lies on a wooden table, his face a mask of pure terror. The surgeon ties him down with thick leather straps, a necessary precaution to keep him from moving. He shaves a small patch of hair from his head, revealing the pale, vulnerable skin of his scalp. He then takes out a small, hand-powered drill, a kind of auger with a sharp metal bit. He places it on your friend's skull, and he begins to turn it. A slow, methodical rotation that makes a sickening grinding sound. You can hear the bone grinding. A horrible, scraping sound that makes your stomach churn. The surgeon drills, and he drills, and he drills. He is creating a hole in your friend's skull, a small circular opening that will, in his mind, allow the evil spirits to escape. Your friend screams, a muffled, horrifying sound that is a mix of pain and terror. You look away, your heart pounding in your chest. You can't watch. You just listen to the grinding, the screaming, the surgeon's muttered prayers. It's a barbaric, horrifying procedure. And you wonder if it is a cure or a punishment. One of the most fascinating and disturbing aspects of trepanning is that it was a surprisingly common procedure. Archaeological evidence has shown that people all over the world, from the ancient world to the Middle Ages, underwent this procedure, and some of them even survived. You see skulls with healed holes, a testament to the fact that people lived for years after having a hole drilled in their head. It is a chilling reminder of the sheer resilience of the human body, a body that can survive a kind of trauma that a modern person can barely imagine. Let's have a quick, bloody laugh, shall we? You're standing in the surgeon's workshop, and a man comes in with a terrible headache. He looks at the surgeon's tools, a look of pure terror on his face. The surgeon looks at him, shrugs, and says, "What's the matter? It's not brain surgery. You don't know if he's joking, and you don't want to find out." The academic debate about the purpose of trepanning is a fascinating one. While the surgeon believes it is to release evil spirits, some historians argue that it was used to treat head injuries, relieve pressure on the brain, or even as a ritualistic procedure. So, while the surgeon's methods were flawed, his intuition may have been onto something, but you, in your horrified state, don't care about academic debates. You just want your friend to be okay. After a long, agonizing hour, the surgeon is done. He has a small, circular piece of bone in his hand, a kind of grisly souvenir. He tells you that the spirits have been released, and your friend will now recover. He bandages your friend's head, and you help carry him home, a limp, pale shadow of the man he was. You don't know if he will live or die. You don't know if the procedure was a cure or a death sentence. But you do know one thing: you would rather live with a headache for the rest of your life than have a hole drilled in your head. The world is a dangerous place, and your body is a fragile, unpredictable machine. And you are at the mercy of men with sharp tools and a terrifying sense of purpose. Your friend survived the trepanning, a quiet, pale ghost of a man who now walks with a strange, hesitant gait. His headache is gone, but he now has a new, terrifying fear of the wind. He says he can feel it blowing through the hole in his head, a cold, whistling whisper that drives him mad. You are a man who has seen a lot. But this is a new kind of horror, a haunting that is both physical and spiritual. You look at your own head, and you feel a new sense of gratitude for your persistent, nagging headache. At least it didn't require a drill, but you have a new ailment, a new terror, a toothache. It started as a dull ache, a kind of low-grade throb that you could ignore. But now, it is a searing, relentless fire in your jaw, a pain that makes it impossible to eat, to sleep, to think. You are at your wit's end. You know what you have to do. You have to go to the barber surgeon, a man who will remove your tooth with a pair of terrifying tongs. This is a brutal, simple procedure, a terrifying reminder that even the most minor ailments are a matter of life and death in this world. You walk into his shop, and the smell of blood and hair fills the air. He looks at you, a grim look on his face, and he knows what you want. He doesn't even ask you to sit down. He just opens your mouth and looks at your tooth, a dark, rotten thing that is the source of all your pain. He shakes his head, a look of pity on his face. He takes out a pair of large, rusty pincers, a tool that looks more like a blacksmith's tongs than a surgical instrument. You feel a wave of pure terror. You remember the last time you saw him use them. The sickening crunch, the screaming, the blood. He tells you to bite down on a piece of wood, a simple stick that is meant to keep you from biting off his fingers. He puts the tongs around your tooth, and you feel a cold, metallic pressure. He tells you to hold still, and you try, but your body is shaking with fear. He gives a mighty pull, and you feel a sickening crunch, a searing pain that makes your eyes water. You hear a loud crack, and you feel the tooth come loose from your gum, a sudden, horrifying release. He pulls it out, a bloody, jagged mess of bone and nerves. The pain is intense, a throbbing, searing fire that makes you want to scream. But you don't. You can't. You have to be strong. One of the more horrifying and little-known details about tooth extraction in the Middle Ages is the lack of any kind of pain relief. There is no anesthesia, no whiskey to dull the pain. You are just a body, a screaming, thrashing machine of pain. The barber surgeon is a professional, a man who has done this 1,000 times. He is not a sadist, just a man doing his job. But to you, he is a torturer, a man who is inflicting a kind of pain that is so intense it is almost spiritual. Let's have a quick dental laugh, shall we? You're sitting in the barber's chair, and a man comes in with a terrible toothache. He looks at the barber's tools, a look of pure terror on his face. The barber looks at him, shrugs, and says, "What's the matter? It's not like I'm going to pull out your whole jaw." The man faints. It's a reminder that a little bit of dark humor can go a long way in a terrible situation. The academic debate about the skill of medieval dentists is a fascinating one. While the methods were obviously barbaric, some historians argue that they were surprisingly good at their job. They were able to remove teeth, treat infections, and even make crude dentures from animal bone. So, while you may have a new respect for your own teeth, you also have a new respect for the men who had to deal with them. You leave the shop with a gaping, bloody hole in your mouth. Your toothache is gone, but it is replaced by a new kind of pain, a constant throbbing fire in your jaw. You have a new respect for your own body, a new awareness of its fragility. You are a bit poorer, a bit weaker, and a lot more scared. You think to yourself, I'm glad that's over. But you know, deep down, that it's not. The world is a dangerous place, and your body is a fragile, unpredictable machine, and you are at the mercy of men with sharp tools and a willingness to use them. You survived the tooth extraction, a victory in a world of constant medical defeats. Your jaw aches, but the pain is a dull, manageable throb compared to the searing fire that was your toothache. You are a survivor, a man who has been bled, purged, leeched, and drilled. You are a walking testament to the sheer brutality of medieval medicine. But now, you have a new ailment, a new fear. Your wife has a terrible fever, a sickness that makes her delirious and weak. You know that she needs help, but you have exhausted all your options. You decide to take her to the one place in town that is a source of both hope and horror, the hospital. You carry her to the hospital, a large stone building that was once a monastery. The air around it is thick with the smell of sickness, of death, of desperation. You walk into the main hall, a vast, cavernous room filled with 100 beds. The beds are simple cots, a bit of straw, and a thin blanket. They are packed together, a chaotic, jumbled mess of the sick and the dying. The sounds of the hospital are a symphony of misery, coughing, moaning, screaming, and the low, constant drone of prayers. The hospital is run by monks and nuns, pious men and women who believe that caring for the sick is a sacred duty. They are kind, gentle, and compassionate. They give your wife a bed, a bowl of thin broth, and a cup of water. They pray over her. They clean her sores. They change her blankets. They are not doctors. They are nurses, caregivers, spiritual guides. They are a source of comfort and hope in a world of constant despair. But the hospital is also a breeding ground for disease. The air is thick with germs, 1,000 different sicknesses swirling around you. The monks and nuns do their best to keep the place clean, but they don't know about germs, about bacteria, about infection. They wash their hands in the same water. They use the same rags. They touch 100 different sick people every day. You see a man with a terrible cough on one bed, and a woman with a festering wound on the next. You feel a new kind of terror. Your wife might have one sickness, but she is now exposed to 100 more. One of the more disturbing and little-known facts about medieval hospitals is that they were not just for the sick. They were also for the poor, the homeless, the disabled. They were a kind of medieval soup kitchen, a place where the sick and the destitute could find a bed and a meal. It was a place of charity and care, but it was also a place of chaos and contagion. You see a man with a wooden leg begging for food, a woman with a withered arm trying to clean her clothes. It is a place of both compassion and cruelty, a terrifying microcosm of the world outside. Let's have a quick hospital laugh, shall we? You're sitting by your wife's bed, and a man with a broken leg is telling a story to a group of people. He says, "The doctor told me to stay in bed and rest. I told him, I can't. I have to go to the tavern." The people around him laugh, a tired, weary laugh that is a welcome sound in this terrible place. It's a reminder that even in the face of death and disease, people still find a way to laugh, to tell stories, to be human. The academic debate about the effectiveness of medieval hospitals is a fascinating one. While the sanitation was obviously terrible, some historians argue that the hospitals were a source of care and comfort that was better than nothing. The patients were given food, shelter, and a clean bed. They were cared for by people who were genuinely compassionate. So, while the hospital may have been a breeding ground for disease, it was also a source of hope, a place where people could die with a bit of dignity. You sit by your wife's bed, holding her hand, watching her sleep. You don't know if she will live or die, You don't know if the hospital is a source of healing or a source of more sickness. You are at the mercy of a world that is illogical, and terrifying. And you feel a sense of profound exhaustion. You are a man who has fought a war against his own body, and you are tired. And as you watch your wife, you feel a sense of peace, a sense of surrender. You have done all you can do. The rest is up to God, to fate, to the whims of a chaotic and brutal world.